So I would first check the patient's history, their documentation, see what the doctor has ordered and that the doctor in fact has ordered an ABG. Look at any medications they're on, such as an anticoagulant, anything that will contraindicate um, this blood draw. Also, look at if they're on any oxygen, their disease processes, whatnot. And once you've confirmed that, once you've established that this needs to be done, we will go to the patient's room, knock, introduce ourselves. Hi, I'm Paxton with the respiratory care program, or I'm a respiratory care student, and I'm here to do an arterial blood gas the doctor has ordered. What this is it takes it's arterial blood, so that will take from your wrist, and what this will tell us is help us measure your blood gases, and it'll help determine whether we need to alter your treatment, or if we need to put you on anything else. That way, your disease process can be better managed. So, when you're starting out, we'll let them know that. Ask them, is it okay if I proceed? Do you have any questions, concerns? Let them know that it will be a little painful. Try to make it as short as possible. And then, so first you'll begin by, after you've gained consent, finding the radial pulse. So I'll say it's right there. And then what you're going to want to do is perform that Allen's test. So you'll have the patient squeeze their fist, not too tight, but firm. And then you'll block off the radial and the ulnar. And that way, once you let go of the ulnar, the patient can, or have the patient hold their hand and let go of the ulnar, and the discoloration will return, the coloration will return, and that will show that the patient has good circulation, that there is no reason not to proceed. A contraindication would be that the patient, in fact, does have poor circulation to their hand, and the color takes longer than 15 seconds to return. So, once it's confirmed that we can proceed, you'll want to wash your hands. You'll wash your hands as you enter the room, and then you'll wash your hands again before the procedure. And then you'll want to clean the area with a 70% alcohol wipe. Just make sure it's thoroughly cleaned. We'll discard of that. All right. And then when you are using the needle, or for this draw at least, we'll go to 1 milliliter. And then when using the needle, you'll remove the lid, and you'll point it away from the patient as well as yourself. That way no one gets poked by accident. There's nothing that needs to happen. We'll set this to a good area where you can recap it with it, no problems. You never want to recap it with it in your hand. So when you're doing this, we've cleaned the area. We'll feel for the pulse again where it's strong. It's right there. Right. So you'll want to do the bevel side up. You can hold it like a dart, like a pencil kind of thing. Go at a 45-degree angle. All right. So I'm gonna poke you here in 1, 2, 3. All right. And then it should begin filling with blood. If it's not filling at like a pulse, it has not reached an artery. However, once it starts filling up on its own, you don't want to pull the syringe, and this should be good to go. And then once this is full, you can remove it. We'll use the gauze pad here. We'll just pull right out. We'll hold it there for about 3 to 5 minutes to help stop bleeding. And then what you'll want to do, you'll take your needle and recap it. And then you'll dispose of this in a sharps container. then you can use this here, which is a Filter Pro device. And what you'll do is you'll connect this to the end here. And what this does is you can slowly push, and it will kind of start absorbing the blood right here, but what it'll do is it'll get rid of any gas bubbles in there. And once that is finished, it'll soak it all up, and once that's soaked up, you can stop. You'll put it in a biohazard bag, you'll send it down to the lab, get things checked out, and then so you'll dispose of your needle in the sharps container. You'll make sure the patient's okay, that their bleeding is managed, see if they're comfortable, and once they're comfortable, thank you, have a good day.